Okay, so this is a nice basic knee health protocol that you can follow along with. Stop if you have any pain as you're going through any of the movements. You can skip those movements. Let me know if you have any questions as we go through it as well. So the first one, we're gonna lift one knee up, kick it straight out, bring it back down and lower. You can alternate, or you can do all 5 on one side and then switch right over to the other. I'm gonna alternate. So we're gonna do 5 on each side, 10 total. 3, 4, just take your time with this. 5, 6, 7, 8, and if you can't do the full 10 right now, that's okay. That's 9. Just do whatever you can, and you're gonna work up to be able to do 10. And 10. Good. The next one, we're gonna do some hamstring isometric exercises. So you're gonna straighten out your knee slightly. You wanna have a slight bend to your knee here. What we're gonna do is you're gonna dig your heel hard into the ground. You're gonna feel the muscles in the back of your leg engage. We're gonna hold that for 3, 2, 1, and then just relax. I'm just gonna do 5 on one side and then I'll do 5 on the other. So again, I'm gonna dig my heel down, hold it for 3, 2, 1, and then relax. Again, dig, 3, 2, 1, relax. You can play around with varying degrees of knee flexion as well. Hold it for 3, 2, 1, relax. 2 more times. 3, 2, 1, relax. You can shake it out in between. 1 more time. 3, 2, 1, and relax. Good. Switch to the other side. So again, I have a slight bend to my knee. I'm gonna dig that heel hard into the ground, hold for 3, 2, 1, and then relax all the muscles. Hold, 3, 2, 1, relax, that's 2. Dig, 3, 2, 1, that's 3. Dig, 3, 2, 1, that's 4, and 1 more time, 3, 2, 1, and that's 5. Good, next one, we're gonna bring the legs back in here, and we're gonna do our tibialis raises. That means we're gonna lift our toes up as high as we can and lower down. So I lift up, hold for a second or 2, and lower. We're gonna do that 10 times. 3, 4, 5, 6, 7, 8, 9, and 10. And then we're gonna lift the heels up. 1, 2, 3, 10 times. 4, 5, 6, 7, 8, 9, and 10. Good. So that's all for the seated portion of this protocol. So if you want, you can just do the seated portion. Next, I'm going to move to the standing portion. Ideally, you have something sturdy that you can hold on to. I have a stall bar system here, but if you have like a mantle or a countertop, something that you could just comfortably hold on to that can support your weight if you need to hold on to it for some balance as well. So the first thing you're going to do is we're going to take a step back. So when you step back, you want to be on your toes, your heel's going to be elevated, and then we're going to come back in. And then step back on the other side. And come back. So this, we can just go back and forth with. If you're feeling quite strong here, you want to test out your range a little bit more, you can work on doing a little bit of a lunge. So you're going to think of bringing your back knee down towards the floor. Now you don't have to go all the way down, but you're just going to go as low as you feel comfortable. That may be like half an inch too, that's fine. Here, lower down, come back. But again, if it's better to just step back for the time being, you can do that as well. Do this 5 times on each side. I've totally lost count, so let's just do 1 more on each side. And good. Next one, you're gonna step out to the side, out to the other side, right? Step out as far as you feel comfortable. You're going to notice that the supporting leg will slightly bend too, so just make sure that that knee also feels comfortable. again, we're aiming for 10 total, 5 on each side, but if you're limited or you're not able to go all the way to 10 reps, then just do what you can. Good. And I'll do one more here. Good. Next one, we're gonna lift the heel up slowly. You're gonna think about kicking your butt. So you may feel the muscles in the back of your legs really cramp up. So don't go so far with this one to the point where you get a leg cramp. We just wanna feel the muscles start to engage and then let go and disengage. So for this one, I like to do all my repetitions on one side first so I can really be in control of the movement before switching. So I'll usually do 5 or 6 on one side. So I'm going up nice and slow, feeling those muscles and then relaxing. A common thing that happens here is that as people lift their heels up, they'll lean forward. So you want to try not to do that. Stay upright. And the other thing too is making sure that the knee doesn't come forward. So we want to keep the knee back as well. And good. We'll switch over to the other side now. So again, standing upright, heel comes back towards the butt. And we're feeling that deep into the hamstring close to the knee joint. So we'll do that about 5 times. And good. Good. I'll do one more. Perfect. And then lastly, we're going to come up onto our tippy toes and slowly lower down. When you're coming up onto your tippy toes, ideally you want to put most of the weight on both your big toe and your second toe. Most people have a tendency to kind of roll out to the edges of their feet when they're coming up, so you want to try to put most of your weight onto those 2 large toes there. But again, as usual, I always lose track of my counting. So we want to aim for about 10 times, but just do what you can, especially at the beginning. So again, for this protocol, you can either just do the standing portion, you could just do the seated portion, or you could do both. Try to aim to do it at least once a day, but whenever you feel like you need to work on your knees, you can throw this on and give it a try. Follow along with me.